Hello everybody, welcome back. Today our topic is localized cyanosis. But first, before we talk about cyanosis, let me remind you what are the different skin color changes. Skin color results from 4 natural pigments, with or without other pathologic ones. The 4 natural pigments include 1. Melanin, which is brown, 2. Oxyhemoglobin, which is bright red, mainly within arteries, capillaries. 3. Deoxyhemoglobin, which is more bluish, present in venous blood. The 4th natural pigment is carotene, which is yellow. What about the pathologic ones? Those include 1. Hemosiderin, 2. Bilirubin, 3. metals. Skin color depends on 2 things. 1. Skin thickness. 2. Light. Note that light, artificial light especially, distorts colors. Different skin color changes include 1. Pallor, 2. Cyanosis, 3. Jaundice, 4. Hypercarotenemia, 5. Changes of skin pigmentation, and 6. Hyperemia, which is redness of the skin. So let's talk about cyanosis. Cyanosis is the bluish color of the skin and mucosal surfaces due to 1. The presence in the circulating blood of an increased quantity of the reduced hemoglobin, more than 5 grams per deciliter, or 2nd is the presence of a different type of hemoglobin. Note that cyanosis disappears with digital pressure. Cyanosis is different from false cyanosis. What is the difference between them? False cyanosis is the discoloration of the skin induced by deposition of gold salts, silver salts, arsenic or other compounds. Note that false cyanosis does not disappear with digital pressure when compared to cyanosis, which disappears with digital pressure. Cyanosis can be localized or generalized. Generalized cyanosis include central or peripheral. Let's talk about central. Central cyanosis include pulmonary central cyanosis and central cyanosis with right to left channel. As peripheral is cardiac stasis cyanosis. What is localized cyanosis? It is due to an increased tissue extraction of arterial blood produced by 2 mechanisms. A decreased arterial supply. 2nd mechanism is the slowing down of venous capillary circulation. Localized cyanosis can be acute, can be chronic. Acute, like in the cases of thrombophlebitis, arterial embolus. As for the chronic localized cyanosis, in the case of acrocyanosis, peripheral chronic ischemia syndrome. What are the different examples of localized cyanosis? The different examples of localized cyanosis include 1. Acrocyanosis, 2. Livido reticularis, 3. Face cyanosis, and 4. Erythrocyanosis. What is acrocyanosis, which is one of the localized cyanosis? Acrocyanosis refers to a persistent blue or cyanotic discoloration of the digits, most commonly occurring in the hands, although also occurring in the face and feet as well. Where does acrocyanosis appear? Or when does acrocyanosis appear? It appears in cold exposure, in phlebitis, chronic venous failure, and Raynaud syndrome. Causes of acrocyanosis include functional anomalies in capillary circulation. What about livido reticularis? Livido reticularis is a lace-like purplish discoloration. A particular aspect is racemose livido, a permanent red-violet arborization in systemic lupus erythematosus. Abdomen, acute pancreatitis. What about face cyanosis? Face cyanosis occurs in venous thrombosis. Occurs in superior vena cava syndrome. So, face cyanosis can occur in venous thrombosis and can occur in superior vena cava vein syndrome. What about erythrocyanosis? Erythrocyanosis appears in polycythemia vera. It is also called the red cyanosis. So it's a note here that the red color is erythrocyanosis, described by Osler as red like roses in the summer and blue like indigo in winter. Color changes are more obvious in the areas exposed to temperature variations like the face and hands. It is associated with pruritus, which commonly starts after a bath. Thank you for watching and looking forward to see you in the next video with a new topic.